This show is for educational and informational purposes only. It is not to be used for diagnosis, evaluation, prevention, or treatment, which requires your medical team. If you want to keep your feet for a lifetime, take care of your feet for a lifetime. That's the concept. This show is all about taking care of your feet. Don't let your foot hide in the shoe. Deal with any issue you have with your feet. Share your plan with your doctor and healthcare team and get their help when you need it. The diabetic foot is not a healthy foot. If things don't look right, or if you see anything unusual about your feet, ask for help. Here's a reminder. Call your doctor right away if a cut, blister, or bruise on your foot does not begin to heal after a few days. Some doctors want to know immediately if you have a cut or blister or sore on your foot because some doctors believe there is no minor injury to the diabetic foot, and they want to see your foot heal in a timely fashion. Why is foot care important? Over time, diabetes can cause you to lose feeling in your feet. When you lose feeling in your feet, you may not feel a pebble inside your sock or a blister on your foot, which can lead to cuts and sores. So think about it. If you have proper feeling in your feet and a little rock jumps into your shoe, you will stop and take the shoe off and shake the rock out. With walking, every so often a small rock does jump in your shoe. Without proper feeling, you will not notice the rock and continue walking on it, and it can wear a hole in your foot. The same is true for worn linings in the shoe and a shoe that pinches. Diabetes also can lower the amount of blood flow in your feet. Numbness and less blood flow in the feet can lead to foot problems. Foot care is very important for all people with diabetes, but even more so if you have pain or loss of feeling in your feet, that is numbness or tingling, changes in the shape of your feet or toes, sores, cuts, or ulcers on your feet that do not heal. Managing your blood sugars can also keep your feet healthy. Diabetic complications accumulate, so the longer and more often you have high blood sugar, the more damage that is done. Managing your blood sugar can be tricky. The numbers are important, and you will get to know your patterns. Note that neuropathy sometimes decreases the feeling you experience with the changes in the blood sugar numbers. Work with your healthcare team to make a diabetes plan that fits your lifestyle and includes your foot care. So you can't leave foot care out because diabetes affects many parts of your body, such as your eyes, kidneys, heart, blood vessels, and your feet. So you need to include foot care in your lifestyle plan. Okay, who's on your team? The team may include your doctor, a diabetes educator, a nurse, a podiatrist, which is a foot doctor, and other specialists that can help you manage your diabetes. Vascular surgeons can get involved if there is foot problems or circulation problems. There is a toe and flow model to foot care where the toe is the foot doctor and the flow is the vascular surgeon. You need a whole team to help with the diabetic foot. For example, wound care or infectious disease specialists may be consulted. Check your feet. This is common sense. Here's what you have to do. You have to check your feet every day. Check your feet for cuts, sores, red spots, swelling, and infected toenails. You may have foot problems but feel no pain in your feet. Check your feet every evening when you take off your shoes. If you have trouble bending over to see your feet, use a mirror to help. You can also ask a family member or caregiver to help you. Wash your feet every day. The following are good self-care behaviors. Wash your feet in warm, not hot water. Do not soak your feet because your skin will get dry. Before bathing or showering, test the water to make sure it is not too hot. You can use a thermometer. 90 degrees Fahrenheit to 95 degrees Fahrenheit is safe. Or you can use your elbow to test the water. Use talcum powder or cornstarch to keep the skin between your toes dry to prevent infection. Cornstarch and talcum powders each have their own complications. Ask your doctor or podiatrist which is best for you to use. Put lotion on the tops and bottoms of your feet. Keep the skin soft and smooth. Rub a thin coat of lotion, cream, or petroleum jelly on the tops and bottoms of your feet. Do not put lotion or creams between your toes because this might cause an infection. Gently rub calluses with a pumice stone. Smooth corns and calluses gently. Thick patches of skin called corns or calluses can grow on the feet. If you have corns or calluses, check with your foot doctor about the best way to care for them. If your doctor tells you to, use a pumice stone to smooth corns and calluses after bathing or showering. A pumice stone is a type of rock used to smooth the skin. Rub gently, only in one direction, to avoid tearing the skin. Do not cut corns and calluses. Do not use razor blades, corn plasters, or liquid corn and callus removers. They can damage your skin and cause an infection. If you can see, reach, and feel your feet, trim your toenails regularly. Trim your toenails with nail clippers after you wash and dry your feet. Trim your toenails straight across and smooth the corners with an emery board or nail file. This prevents the nails from growing into the skin. Do not cut into the corners of the toenail. Have a foot doctor trim your toenails if you cannot see or feel your feet, if you cannot reach your feet, if your toenails are thick or yellowed, if your nails curve and grow into the skin. Check inside of your shoes before you put them on. Wear shoes and socks at all times. Do not walk barefoot when indoors or outside. It is easy to step on something and hurt your feet. You may not feel any pain and not know that you are hurting yourself. Make sure you wear socks, stockings, or nylons with your shoes to keep them from getting blisters and sores. Choose clean, lightly padded socks that fit well. Socks that have no seams are best. Check inside your shoes before you put them on. Make sure the lining is smooth and that there are no objects in your shoes. Wear shoes that fit well and protect your feet. Protect your feet when walking on hot surfaces. Protect your feet from hot and cold. Wear shoes at the beach and on hot pavement. You may burn your feet and may not know it. Put sunscreen on the top of your feet to prevent sunburn. Keep your feet away from heaters and open fires. Do not put hot water bottles or heating pads on your feet. Wear socks at night if your feet get cold. Wear lined boots in the winter to keep your feet warm. Keep the blood flowing to your feet. Put your feet up when sitting. Wiggle your toes for 5 minutes 2 or 3 times a day. Move your ankles up and down and in and out to help blood flow in your feet and legs. Do not cross your legs for long periods of time. Do not wear tight socks, elastic, or rubber bands around your legs. Do not smoke. Smoking can lower the amount of blood flow to your feet. Ask for help to stop smoking. Call 1-800-QUIT-NOW. That is 1-800-784-8669. Bike riding is good exercise. Be active every day. Being active improves blood flow to the feet. Ask your healthcare team for safe ways to be more active each day. Move more by walking, dancing, swimming, or going bike riding. If you're not very active, start slowly. Find safe places to be active. Wear athletic shoes that give support and are made for your specific activity. Be sure to ask your healthcare team to check your feet at every visit. Check the sense of feeling and pulses in your feet at least once a year. Show you how to care for your feet. Refer you to a foot doctor if needed. Tell you if special shoes would help protect your feet. Take care of your diabetes. Work with your healthcare team to make a plan to manage your diabetes. Ask your healthcare team to help you set and reach goals for managing your blood sugar, your blood pressure, and your cholesterol. Ask your team to help you choose safe ways to be more active each day and choose healthy foods to eat. Tips for choosing the right footwear. Wearing the right type of shoes is important for keeping your feet healthy. Walking shoes and athletic shoes are good for daily wear. They support your feet and allow them to breathe. Never buy shoes that do not stretch or breathe. When buying shoes, make sure they feel good and have enough room for your toes. Do not wear shoes with pointed toes or high heels often. They put too much pressure on your toes. Buy shoes at the end of the day when your feet are the largest so they can find the best fit. Medicare and other insurance for special footwear. You may need special shoes or shoe inserts to support your feet. Medicare Part B insurance may cover some of the cost of special shoes or inserts. Ask your doctor if your insurance plan will pay for depth shoes or inserts. Depth shoes look like walking shoes but have more room in them. The extra room is for different shaped feet and toes, or for inserts made to fit your feet. They may pay for custom molded shoes with inserts. Ask your doctor or foot doctor how you can get this special footwear. Things to remember. Set a time every day to check your feet. Wear socks and shoes at all times. Write down the date of your next visit to your doctor. Go to all of your appointments and ask any questions that you have. Set a date for getting the things you need to take care of your feet. Nail clippers, pumice stone, emery board, skin lotion, foot powder, plastic mirror, socks, walking shoes, and slippers. Stop smoking. Manage your diabetes so you can prevent foot problems. To learn more, check out this list that contains a wealth of information for everyone involved in diabetes. Each resource should be thoroughly explored. As always, we are friends in the fight for feet. This is the Diabetic Foot with Dr. Joe.